Welcome to the travel edition of our 3-minute medical updates. As you journey through the wonders of our world, it's essential to remember that our health travels with us. These videos are designed to introduce location-specific background medical and health-related information to help you plan your visit safely. So wherever your adventure takes you in our amazing world, join us as we explore key health topics to support your travel planning, one 3-minute update at a time. Dia do it. That's God to you, in Irish Gaelic. Wonderful Ireland, the Emerald Isle where every clover has 4 leaves and every pub conversation is a piece of lyrical poetry. From the rugged cliffs of Maher to the historic Kilmainham Jail and the bustling streets of Dublin, Ireland offers a rich tapestry of experiences. But before you get lost in the Irish folklore, let's talk about keeping you in the pink of health during your visit. The first concern is the high rate of respiratory conditions, including bronchitis and asthma. The Irish weather can be quite damp, so carrying an inhaler or antihistamines is a good idea, particularly if you, or someone you know, can be susceptible to respiratory issues. Next, we have hepatitis B, another vaccine-preventable disease. It's particularly recommended for travelers under 60. Lastly, measles can be a concern. Infants 6 to 11 months old traveling to Ireland should receive 1 dose of measles, mumps, rubella, MMR, vaccine before travel. This dose may not count as part of the routine childhood vaccination series, so also check with your family doctor. One of our friends, an adventurous soul, hiked the Wicklow Mountains. She was well prepared, or so she thought, until she realized she had forgotten her insect repellent. By evening, she was covered in bug bites. Fortunately, she met a local who advised her to apply a mixture of baking soda and water to alleviate the itching. She followed the advice and was able to continue her journey without much discomfort. While Ireland's food safety standards are high, be wary of shellfish, especially if you're dining in less touristy areas. Shellfish can be a source of foodborne illnesses if not properly cooked. On the other hand, don't miss the opportunity to indulge in locally sourced dairy products. The Irish cheese and butter are not just delicious but also rich in essential nutrients, thanks to the country's lush pastures. Oh, and don't forget to try Guinness, a beverage that flows as freely as the River Shannon. When in Ireland, do as the Irish do. Many locals swear by a cup of hot tea to not just warm the soul but also to keep colds at bay. And let's not forget the age-old Irish tradition of a brisk walk in the fresh air to clear the mind. So, why not take a leaf out of their book? Ireland boasts a robust healthcare system, and you'll find that most healthcare professionals are fluent in English. In case of an emergency, dial 112 or 999. It's advisable to have travel insurance that covers healthcare costs, as medical treatment can be expensive for non-residents. Additionally, it's a good practice to always have a list of local doctors and hospitals handy during your stay. Thank you for tuning in to today's 3-minute medical vlog. If you found our content valuable, give us a thumbs up and hit that subscribe button for more insightful medical updates. Sharing is caring, so spread the word and help us in our mission to make health information accessible to all. Remember, your health is your wealth. And as always, for personalized advice or deeper insights, it's best to consult with a healthcare professional. Until next time, take care, stay informed and happy traveling. Please also share your travel health tips or experiences in the comments below. And don't forget to check out our other videos in this series for more travel health insights.